the Global Medical News Network, I'm Heidi Splete, reporting live from the annual meeting of the American Medical Directors Association in Charlotte, North Carolina. I spoke with one physician who studied undiagnosed diarrhea, intestinal inflammation, and C. difficile colonization in long-term care residents. What did you hope to find in this study?
So we were looking to see if we could find a correlation between diarrhea, inflammatory diarrhea, and weight loss or changes in functional status among elderly residents in our local long-term care facility. We had a population size of about 46 patients, and what we found in that was that over half of our sample patients had diarrhea, which was surprising because only 5 patients had been reported to have diarrhea. So our first interesting finding in the study was that diarrhea in the nursing home is underdiagnosed, which is an important point because those are patients that we need to focus on. A second point that we found was that of those patients that had diarrhea, over half of them had an inflammatory process contributing to their diarrhea or in association with their diarrhea, as marked by increased levels of fecal lactoferrin, suggesting that it's not just laxative use causing this diarrhea, but there's actually a pathology going on causing an inflammation.
So what would be the clinical implications for physicians treating these patients?
Well, what we're hoping to show in the next study is what's causing this inflammation. Is it an underlying C. diff infection? Is there another intestinal pathogen causing this inflammation? Or is there another underlying pathology causing some sort of protein loss or malnutrition? And if so, how do we best target those patients? Those are answers that we don't know yet, but that's our next line of study.
Great, thank you very much.
Thank you.
From the Global Medical News Network, I'm Heidi Splete.